All right, I'm just going to start off by giving my patient profile. So, my patient is a 48-year-old male who is a recreational runner who presents with lateral knee pain, specifically meniscal pain. Also presents with joint effusion and then quadriceps inhibition that is secondary to that meniscal irritation. So, the overall goal of this treatment is to improve quad activation and then progress the patient towards returning to running. So, I'm just going to go ahead and kind of hop back and forth between talking to my patient and also explaining what I'm doing. So, first, I'm just going to do a quick screening for my patient to ensure that this treatment isn't a contraindication for them. Hi there, my name is Bailey. I'm going to be your student physical therapist today. How are you? Doing good. Good. All right. So for this treatment we're going to be doing today is we're going to be working on that quad activation in your leg. So it requires some electrical stimulation. Okay. So I just want to make sure that we don't have any contraindications to that. So do you have a pacemaker or any internal electrical device? No. Okay. And then have you had any recent cardiac events? Deep vein thrombosis, anything like that. Okay, and then how about have you had any malignant tumors or cancer in the area on your right thigh? Nope. Okay. How about any open wounds to that area that I should be aware of? Nothing. Okay. So then we are good to get started. So I'm just going to kind of explain what we're going to be doing, and then I'll have you lay on your back. So it's an electrical stimulation. So I'll be applying it to. There's these little pads I'll be applying to two different areas on your leg. And then you're going to be laying on your back, and then I'm going to put a little towel under your knee. And then I'm going to set it on a cycle that is going to send an electrical stimulation to your muscle, and it's going to cause your muscle to contract. And that'll kind of lift up your leg into an extended position, okay? So what that's doing is we're just working on, your quad has been kind of deactivated by your injury that you had, so we're trying to reactivate it again. So we're just going to be working on that strength. So that contraction will stick around for 10 seconds, and then you'll get a 50-second rest so that because we don't want that muscle to fatigue. Does that sound okay with you? All right, so I'm gonna have you go ahead and lay on your back. You can have your head down here. And then I'm just gonna place this under your knee here. And then in order to clean and prep the area, I am just using an isopropyl alcohol wipe. So I'm just gonna go ahead and do that. Is it okay if I roll your shorts up just a bit? Okay. So I'm just gonna go ahead and clean the whole area where I'm going to be applying the simulation pads. So this is just an alcohol wipe that I'm using just to clean the area here. Sorry if it's a little cold. Also, if the patient is okay with it, I could shave the hair in the area just to get a better electrical stimulation through there. Okay, so just to go over kind of the parameters of the electrical stimulation. So I would be using the neuromuscular electrical stimulation for this, and I would be using a bipolar electrode. So this is what I have just for today. I would probably use something a little bit bigger if available. And then I would have them placed over the quadriceps motor points, which I will show in a little bit. I will be using a biphasic pulsed current, as that is induces a strong contraction, but is also well tolerated by patients. I'll have a frequency of 35 to 50 hertz to produce a smooth tectonic contraction. So that range is just kind of what produces that contraction for the patient is also still well tolerated by them. And then a pulse duration of 200 to 400 microseconds to recruit those motor fibers in the quadriceps. And then I would do, as explained to the patient, I would do a duty cycle of 10 seconds on with the contraction and then 50 seconds off. just to do that to reduce fatigue for the patient in the quadriceps specifically. I could progress it by lowering the rest time, maybe to a 1-3 ratio. So I'm going to place the electrodes. So I'm going to place them specifically on the rectus femoris and then also the vastus medialis. And I'm going to be looking for those motor points. So I can place them approximately and then kind of move them around to see how the quadriceps contraction reacts. So I'm going to go ahead and place these. All right, Josh, so I'm just going to be placing these two pads here. This is what produces the electrical stimulation. So it is a little bit sticky, but is it okay if I apply that to your leg right now? All right, so I'm going to go ahead and do that. And then I want to create a big gap in between as that would help produce a greater contraction. Do that, and then on the vastus medialis. And I want to make sure I'm not placing those over any bony structures either. Also, as I stated, I can start the duty cycle and I could move those around just a little bit to see if I can produce a greater contraction. I'm going to go ahead and zoom up on the placement of my stimulation pads. All right, so this is the placement of my electrical stimulation pads. And then they would be connected to the device to produce that current. I also have that towel roll underneath the knee for when the contraction is produced, there should be knee extension. So that towel roll kind of helps with the comfortability for the patient. So just to start for my patient with treatment, I could do this, I could do the duty cycle for 10 to 15 minutes. So in that minute, there will be one contraction per minute. So for 10 to 15 minutes, I would get 10 to 15 contractions. So that would be my treatment for the neuromuscular electrical stimulation.